Good day, ladies. We are here to continue with our discussion on EBS147, HIV and AIDS, and other endemic diseases in Africa. And as usual, the course lecturers are Moses Azwara and Ms. Akushaba. And we're going to zoom in into what we call the counseling and caregiving to those infected and at risk of HIV. And that's Unit 6. The first video that I did, that one contained Unit 1 up to 5 in one video. So today we'll look at Unit 6 and other units if time will permit us. So COVID is real. Keep to all the safety protocols to protect yourselves, families, and those around us. The COVID is really threatening our society, so keep to the safety protocols. Alright. So lesson indicators. By the end of the lesson or this introduction, learner will be able to explain what counseling and testing, state and explain 5 reasons why counseling and testing is necessary in an individual's life, explain the stages involved in undergoing counseling and testing. What is counseling then? When you were in senior high, some of you were taken through some counseling about your career or any other social problem that bothers your mind. So we're going to look at the meaning of counseling in the face of HIV and AIDS. It is a dialogue, a communication, or a chat, or a conversation between a service provider, that's a counselor, and a client to assist the client work through a situation or a problem. So counseling usually is just a conversation between the client, the person who is infected with HIV, or the person who has the problem, and then the service provider, who is a trained counselor, who will assist the client or the person who is infected to work through problem or situation. So counseling and testing is a process by which an individual finds out whether he or she is infected with HIV. After we have taken you through the counseling, then it is now left onto the client to decide whether he or she is going to embark on the test or not. And usually under counseling, the focus is to lay bare the facts for the client to understand the consequences of engaging in unprotected sex or otherwise. We don't suggest for clients to take decisions. No. We tell the clients the consequences, the good aspects, and the bad aspect for the client to now make a choice. So the choice rests on the client, not the counselor. We don't provide these services and then ask you, oh, we suggest you abstain from sex. We suggest you do ABC. No. We will tell you the consequences when you are engaged in unprotected sex, the consequences of the protected sex. Then you, the client, will now decide which one to take. And that's the essence of counseling. Alright. Types of HIV counseling and testing. According to the World Health Organization in 2007, they have come out with two main types. We have what we call client-initiated HIV counseling and testing, and then service provider-initiated HIV counseling and testing. So basically there are few types of HIV counseling and testing. So let's look at the two into detail. So client-initiated counseling and testing involves individuals actively seeking HIV testing and counseling at a facility that offers these services. Assuming you have engaged in unprotected sexual intercourse and you know your life is in danger, then probably you may want to go and then find out, seek for solution to that problem. Or sometimes you want to travel outside Ghana, where you are required to take an HIV test. Then you have to visit the facilities that offer counseling and testing of HIV to seek for solutions. So it is also conducted in a wide variety of settings, including health facilities. When you go to the hospitals, I believe all the hospitals, they have trained counselors on that. And then probably there is also a standalone facilities. There are certain facilities designated for only HIV and AIDS counseling activities, or outside health institutions, or through mobile services, where there are some of the vans, they move from one location to the other to counsel people on HIV, AIDS, and then community-based. Others too can also be found in our communities. Right. I also have the service provider initiative. This refers to HIV testing and counseling, which is recommended by healthcare providers to persons attending healthcare facilities as a standard component of medical care. Sometimes you visit the hospital and your condition will warrant a counselor. You need to talk to a clinical psychologist. So medical doctor or practitioner may give you a check or may refer you to these people or experts to counsel you on certain pertinent health-related issues. That's why oftentimes you go to the hospital, you visit the doctor in charge, then he gives you a check, go to the lab, for lab test, or go to the counselor for an interaction. All these constitute what we call service provider initiative. So now let's look at the difference between HIV counseling and testing. So HIV counseling is a confidential conversation between an individual and then the care provider to examine whether the person has an HIV or not. And that conversation is always between you and the counselor, and there is no third party. You, the counselor, has no legal right to, disclose any bit of information that actually transpired between you, the counselor, and that of the client. In other jurisdictions, when you do that, you assume you can take you to court. While testing is a process that determines whether an individual is infected with the HIV or not. That's the differences. The other one is a confidential conversation or a discussion, while the other one is a process that determines whether the person is infected with HIV or not. We are saying that HIV testing because when you are now through with the counseling, you've taken a decision to go and test to determine whether you're HIV positive or negative. Then your blood sample will be taken and you'll be subjected to what? HIV testing. Let's look at why counseling and testing is necessary. Why counseling and testing is what? Necessary. One, It helps the individual to understand his or her situation more clearly. There are some of the people who have misconception about HIV and AIDS, its mode of transmission, its mode of spread. In our in our first video, we discussed misconception about HIV and AIDS. So these trained counselors, they have more knowledge, they are expert in the field, and they will be able to help you understand your situation more clearly. It also helps you to make a choice that fits your values and feelings. So after they've taken you through the counseling, then you have to make your own choice. Whether you engage, you still go back and engage in the unprotected sex, or you are going to engage yourself in practices that will not actually predispose you to what infections. It also makes his or her own decision to act on them. So assuming you now realize you've taken through the test and you are negative, then you need to practice in such a way that you will not be infected. If you're also infected, then there are certain things you need to do in order to protect yourself and to protect your family and your loved ones and partners. Then you also develop what we call life skills, such as being able to talk about sex with a partner. So if you are married or if you are a couple, you can now freely share your opinions on sex. There are certain African countries where partners cannot even share their sexual life with their partners. They also provide support for others while preserving their own strength. So if you know you're positive, you know what to do to protect yourself. There are certain things you need to do. You do some slight exercise, you eat balanced diet, you abstain from sex. All these will help you to prolong your life and preserve your energy. It also prevents mother-to-child transmission. Also, we discussed this one in the first video, mother-to-child transmission, and then it also reduces what stigma and discrimination. What is making the fight against HIV and AIDS and other sexual transmitted infection difficult is stigma and discrimination. Once they know that you are HIV positive, people will shun your company. They will not even come closer to you. It's just like COVID. Even those who have recovered from coronavirus, their families are running away from them. So stigma and discrimination is something that is making it difficult for us to fight against HIV and AIDS and other endemic diseases. Let's look at the stages involved in counseling testing. So we have one, pre-test counseling. Second one is what we post-test counseling, crisis counseling, and then adherence or counseling. So let's look at them. Pre-test counseling, there are certain things you need to do. And then the pre-test, that is before the test. You need to establish what we call a good rapport, a relationship between you as a client and that of the counselor. So if you don't trust, you don't have that kind of, you don't relate well with that particular service provider, you find it difficult to disclose any information about you to the service provider. And that's why oftentimes when you go to a hospital and they ask you, how long have you been sick? Then you say, oh, just last week. Meanwhile, you were sick for over 5 years, some 2-3 years. That kind of trust is not there. And also identifies him or her and clarify his or her role. So if you come to me, if I'm a counselor, you come to me, then I have to also tell you my role as a counselor. Alright. State how much time is available. So if it is, we are going to spend 1 hour talking about HIV and AIDS, about that particular issue, then I have to let you know. And another crucial thing we need to do as a counselor is to emphasize confidentiality. I need not, under no circumstance, disclose all that we discuss with me as a counselor to any third party, unless I seek your consent, unless you give me the permission. If I do that without your permission, you can take me to court, and the law will not spare me or spare the service provider. Obtains client particulars, for instance. So you need to obtain the particulars of the client, maybe his or her name, sex, whether a male or female, the religion, whether Christian or Muslim, or African traditional religion, hometown, and you have to also establish what we call client's persona. Talk of the smoking habit, does the person smoke, does he drink, does he take drugs, all these must be taken into consideration. Then you have to also obtain sexual history of the client. Very, very, very important. 80% of HIV infection is through heterosexual intercourse. So if you visit any health facility and you have an STI or sexual transmitted infection, then the doctor asks, how long have you been suffering from this condition? Or when was your first sexual encounter? Then clients begin to tell lies. Doctors or medical doctors, they normally need this kind of information. When they are prescribing the drugs, they prescribe it in such a way that when you take them, it will be able to help you reduce the risk or cure your condition. Also access client understanding of what the test results entails. Let the clients understand, if I test positive, what does it mean? If I test negative, what does it mean? Assess clients' knowledge on HIV and AIDS, especially on misconceptions. So try to ask some basic questions about HIV. What is the meaning of HIV? So what are the modes of HIV transmission? You need to let the client understand. Ask some basic questions, proven questions, leading questions for the client to answer, and then you try to help the client, clear of any misconception or misunderstanding or misinformation about HIV. Now, they explore personal implications of having the test, and provide sex education on safer sex. Safer sex is that one, you can abstain from sex or probably use a condom during sexual intercourse. So discuss with clients as to what would be required of the client in behavior in the event of being positive or negative. So if you are not careful and then the person happens to go for the test result and it is positive, if you are not careful, that person can even die in your presence. Yes, it is not easy to break the news that, oh, you are HIV positive. It is always, good when the news is good. But if the news is negative, you need to find a way to be professional in disclosing the news to the client. Explore what we call psychological reaction and support mechanisms. Sometimes you need to look at the behavior of the person. How does the person behave? And now, whilst we are interacting with the client, we need to look, into the face of the client. Facial expressions count the process of counseling. Explain how the test is administered and how long it will take for the results to be available. Sometimes it takes days, some weeks. So let the client understand. Some of them also even accept to test, but they will not even come for the results. We even call their line and they are highly unavailable. It happens sometimes. Inform client of where the test is done. So if it's done at the laboratory or where we need to indicate. If same day test is not used, send the client to a place for support as he or she wait. If probably people are in the queue or maybe the testing will not be done today, you need to still engage the client. Let the client feel free. Provide opportunity for client to ask questions. Give them room. Give the client room to ask series of questions. If client decide to undergo the test, the counselor obtain informed consent. So you don't have to coerce or force the client to undergo the test. No, that is not your work. But if the client says yes, I am now convinced I can do yes, obtain what we call consent. Permission has been granted. Arrange a date and time for a follow-up interview or the test, and it is your duty to also follow up. You can sometimes call, and even speak with them on phone. It helps. Let's look at post-counseling. So we are now with pre-test counseling. Let's look at post. Post, helping a client who tests negative to understand how to protect him or herself from contracting HIV. So in case the client comes, the person tests negative, then there are certain things you need to do to empower that particular client with pieces of information to protect himself or herself from contracting the HIV. An example is what? Abstinence, or person can use condom. A condom is not 100%, so you have to be careful. Helping a client who tests positive to find the health care they need and provide resources on positive living. So assuming the person tests positive. If they say the person is positive, it means that the person is infected with the virus. There are some of you who still do not know the difference between negative and positive. There was one student who contacted me and I asked, so what was the result? He said, oh, I was tested positive, So it means that he didn't have the virus, So some of these things, when you are tested positive, it means you are infected. And what you need to do to remain, active, is to abstain from sex, engage in light exercises. You need to also do some what we call well balanced diet, and then also abstain from smoking and other things that can put stress on your immune system. And then begins the blood test session by asking how the client has been feeling since he or she had the blood tested. Congratulate the client for returning to hear the test results. That's what you need to do. Oh, thank you so much for coming. In fact, you have even did very well for even allow your blood sample to be taken for the test. And it is good you've come for the test result. These are the things we need to prepare the client's mind. Ask if the client has any questions. Then ask any questions. And because the person is eager to hear the results, and is it good news or bad news? So you have to be professional in discharging or disclosing the information to the client. Then ensure that the client has understood the test results and integrated the information cognitively, emotionally, and behaviorally before proceeding. You need to prepare the person's mind. Let the person understand if he or she tested positive, what it means to be a positive HIV patient, or it needs to be negative. And even to let the person understand that even now there are available drugs that can prolong your life. There are certain things when you do your life, you can stay healthy, you can even still give birth. And even in the face of HIV is not the end of the world. These are some of the things you need to prepare the mind of the client if that person is tested positive. And if the person is also negative, the way of what encouraging the person to either abstain from sex to practice what we call safer sex. Assess cognitive understanding by asking client to tell you what the test result means. Checking for any misconception or misinformation. Very, very key. And I took you through misconception of HIV. Others are saying that it's a curse from God, the same mosquitoes also can transmit HIV. All these are false. Assess emotional understanding by asking client how he or she is feeling at the moment. It is very, very important. There are some of the clients who are too emotional. So the moment you disclose bad news and you're not careful, there will be a war in your office. So you need to be professional in discharging disclosing the news to the client. Proceed to behavioral integration requires that the client makes an immediate plan as well as plans for partner notification, modifying the risk reduction will depend on the other. So assuming if you are a married couple, men normally find it difficult to even visit these health centers to check whether they are HIV positive or they have any STI. It's the women that do that. So in case you are positive, how are you going to inform your partner? How do you break the news? All these must be done by the counselor. You need to take them through how to break the news, how to engage the other partner, And sometimes when you even invite the male partners to come over for an interaction, they will never come. So behavior changes depending on the test and the client's situation. So if the person is positive, then automatically probably your husband may also be positive. Or sometimes too, a woman may be positive and the man is negative. It happens in several jurisdictions. Sometimes the man is positive, the woman is negative. So when that happens, what do you do? So as a counselor, you need to incorporate this and engage the clients to understand these. And then we also have what we call crisis counseling. A person who is HIV positive will face several crises, which include what we call opportunistic infections. Opportunistic infections, they are infections that, attack the immune system because your immune system is weak. There are several diseases that attack the same person at the same time. That's what we call opportunistic infections. The person is suffering from candidiasis, the same person suffering from cancer and others. So this counseling is provided to help the patient manage the crisis he or she is likely to face. You're not positive. What do you do? There are certain infections. You don't need to engage in sexual intercourse. You don't need to engage in unprotected sexual intercourse rather. But if you are HIV positive, you can still put on condom and enjoy sex. But there are certain you need to abstain from smoking. You need to abstain from alcohol and others. Behavior that can predispose you to infections. You need to abstain from it. Stay away, and the patient must freely decide the best option for their situation. Here, the patient should also report back to the counselor and tell him or her about the progress that is he or she is making. Sometimes, if you go and then report back to your husband that I'm HIV positive, if you're not careful in the African context, that marriage is gone. So you need to, if anything, call the counselor. We have what we also adherence counseling. It involves changing behavior so that the patient is disciplined and conditioned to take medication. Sometimes because you are non-positive, you've been given some antiretroviral drugs, and the drugs are said that when you take it 9 o'clock, it should be 9 o'clock. That is how it is. And it should be every day. If it is every day, you need to take it every day at the specific time. And that's what we call adherence. And there are certain conditions you need to undergo to ensure that all medications are taken according to the prescription given to you by the doctor. And you should start from the time of the diagnosis of HIV. It's what made. There are some people, they take the drugs 2-3 days, they stop. Then the next day, when you do that, you are creating a problem for you, for yourself. Because when there is reinfection, then the virus can easily replicate, can multiply, and destroy your immune system more rapidly. So these are questions you need to work and then get me the answers. Explain the following terms: counseling, testing, and state and explain 5 reasons why counseling and testing is necessary in an individual's life. It's a sample examination questions. Explain the stages involved in undergoing counseling and testing. Let's move on to Unit 7, the impact of endemic diseases on the individual, community, and nation. When we talk of the impact of what are the consequences when you are infected with HIV, how will your family feel? How will you feel as an individual? How will the community feel? How will the nation as Ghana feel about people who are sick, people who are suffering from diabetes, people who are suffering from HIV, people who are suffering from hepatitis and others? What are the negative consequences? One, we are saying that reduction or loss of jobs and consequent reduction in household income. Assuming the breadwinner is HIV positive, the person can no longer work. Then the person is out of job. Who is going to provide for the family? It means that the household income will reduce. And readjustment of household budget due to an increase in the direct cost of healthcare. So if every day you pick a car to the hospital, you buy drugs, then if initially you used to feed your family 3 times a day, then you need to readjust your household budget and income as well. So you can now make it 2 meals a day, or sometimes 1. Also increase in the rate of dependency and poverty. So now, you the breadwinner, you are sick. Your wife is also sick. Your children are also sick. Who is going to take care of you? You now depend on the family members. And there is also a reduction in what? Productive investment. If you were a businessman or a woman, you can no longer travel from one location to the other to do business because you are sick. And then the impact on government and the nation or the economy or the country as a whole, it reduces what we call revenue from taxes. If you can no longer work, can you pay tax? You cannot. And also reduction in government. So once you cannot contribute to support the revenue base of government because you're no longer working, then government income also reduce. Look at the COVID pandemic, when several businesses collapsed, the government revenue base also reduced. Because people, under the lockdown, people were home. They don't work. If they don't work, government will also get revenue through taxes from the people. And also reduction in government budget. So government has to reduce budget spending or its spending on other social infrastructure and other social services, because government has also readjust their budget because they don't have enough money. And while they do not have enough money, what happens? They have to also plan well to be able to cope with the situation. And that's what we call the impact. And then reduction in government expenditure for social services and infrastructure. I mentioned that it can be building of hospitals, schools, and what have you. Reduction in direct government investment. Government can no more invest in companies. Because I was told when the COVID pandemic, the Minister of Finance even asked the workers to go home and work at home. Several companies were shut. It also increased in the government budget deficit. Budget deficit in the sense that government, already do not have enough resources to budget for the country. So what happens? All the time the budget is red. There is always the balance is always negative. You don't have anything. You don't have any credit, and that's why oftentimes government has to even rely on donor support from World Bank and the IMF, and sometimes it may also lead to an increased interest rate in the country. Let's look at questions. State 3 effects each for HIV and AIDS and other endemic diseases on an individual's health. Mention and explain 3 ways each for HIV and AIDS and other endemic diseases that can affect the family, the community, and the nation. These are sample questions. You need to work to get me the answers. Unit 8, let's look at the impact of HIV and AIDS on education. Under this unit, let's be careful here. We are looking at the impact of HIV and AIDS on education. And we are looking at the subtopics under this one. They are up to 8 or 9. We have what HIV and AIDS can do to what? Education. And then when we finish, we look at what education can do to HIV and AIDS. Now, what HIV can do to education, or the impact of HIV and AIDS on education, we have one. Demand for what? Education. Now, there is what we call decline in school enrollment. So, if several children are infected, their parents are infected, then automatically the number of children in school or in school going age will also be reduced. In other jurisdictions in Uganda and other African countries where they were severely hit by HIV, you go to the schools and the schools are empty. Teachers are infected, children are infected, so classrooms are empty. So also low population of children of primary school going age. Yes. Those children who are supposed to be in primary school, they are now home. Some are also dead. And then stagnancy and enrollment rate. Every academic year you go, the numbers are not there because HIV has taken over. And then children do not also complete primary education, because if I'm an HIV patient and I'm a child, because of even the stigma and discrimination, I may even happen to even drop out of school. Then we have another one called the point 2. We have what we call supply of what? Education. Here we are talking of loss of personnel through mortality of trained teachers. Because several teachers were infected, most of them died, especially in Uganda and other African countries that were severely hit by HIV. So if several teachers are dead, who is going to teach the children? To also reduce productivity of sick teachers. Here, because teachers are sick, they are home, they can no longer work. And someone they even can, because their immune system is too suppressed. They teach for 2-3 hours, they are down, So instead of teaching probably 8 hours a day, they can teach, say, 2-3 hours a day. And reduction in the system ability to meet school needs due to the loss through mortality or sickness of education officers, inspectors, finance officers, building officers, planning officers, management. So it has affected everything, the entire education system. The directors are sick, they cannot go to the work. The second supervisors are also sick, they can't go. Finance officers, they are also sick. Those who are to provide infrastructure are also sick. Planning officers, all these people are also severely infected by the virus. So when that happens, it brings about a reduction in the system's ability to meet school needs. And also lead to closure of schools. If teachers are sick, they can no longer work. How? Who's going to teach the children? So the government had to what? Close school. When the COVID, the pandemic, what happened? Schools were closed, and schools are even closed as we speak. Who is going there to teach? Everybody fears to die. So that is it. And availability of resources for education is another subtopic. We looked at demand for and supply. Now we are looking at availability of resources for education. There are resources that have been earmarked for education. So because of HIV and AIDS, because of COVID-19, what happens to those resources? There will be reduction in private resources, or it is related reductions in family incomes and the diversion of family resources to medical care. So now that the family is infected, they are affected in a way, the resources for the family, to take care of the family, now they are going to use it to buy drugs. They are using it to take care of the sick people. The same thing applies to government. Now the attention now is now drawn on what? COVID-19. All resources, they are talking about COVID-19. How to manage that pandemic. So all the resources are channeled to what? To managing the pandemic. The same thing applies to this. reduce public funds for education owing to AIDS-related decline in national income. Is it not true? Even the COVID-19, the resource that are supposed to be given to education is now given to the COVID fund to manage the pandemic. Because if your citizenry is healthy, then you have a productive workforce, labor force. If your citizenry is sick, then the entire economy will also be sick. Valuable funds tied to salary for sick but inactive teachers. Look at teachers and other workers at home, they are not working, yet government pays them. There are some people who are COVID positive patients who are government workers, who are private workers. Their employers still pay them. Meanwhile, they are sick, they cannot work. It's also reduced communities' ability to contribute to labor for school development because of HIV-related deaths of active community members who come together as communal labor to help build infrastructure. They are also sick. They are also afraid that they'll be infected with HIV. They're also afraid they'll be infected with COVID. They're also afraid they'll be infected with hepatitis. So who is going to work? Even our own body, they are saying that we shouldn't even touch our face. That is the reality. This particular cause is the reality. What is happening? People are indeed infected. People are HIV patients. People are dying of AIDS. People are dying of COVID. People are dying of hepatitis. This is a real life situation. Potential clientele for education. Rapid growth in the number of orphans. So if parents who are infected die, now there are orphans who are also dependent. They depend on family members. They depend on state. They depend on individuals to survive. That is a huge problem. And they are also saying that it's also a massive strain of orphan problem on extended family members and public welfare officers. You go to the foster homes, they are there. You go to our standard family, they're taking care of orphans whose parents died of HIV or COVID-19 or other sexual transmitted infection, hepatitis and others. Increased pressure on children who are heading households. There are certain families, when you go to other jurisdictions, other countries, children are now heads of family. Because their parents are there. Their extended family members are also away, they can't find them. So they now become the heads of the family. What a pity. It's what HIV and other endemic diseases can do. The poor girls and street children, what do they do now? They have to work to bring money home. Where do they get the money? Some will engage in prostitution, some will engage in street hawking and others. That's a huge problem. Then another subtopic is what we call process of what education. New social interaction that arise from the presence of AIDS-affected individuals in schools. And community perception that teachers are to blame for bringing the sickness to the community. When the COVID emerged, they are saying that Chinese brought the COVID. Others are also saying that travelers brought it. And we, those who are in Ghana, now we are afraid of even going closer to those people who come from abroad. And the same thing applies to HIV. When the HIV first emerged, the community are saying that teachers have brought the sickness to the community, and that is why their community members are also infected. So there's a blame game. Don't know whether it is A that brought the disease or not. So erratic school attendance of people from AIDS-affected families. So because they are infected with HIV, some of them, they go to school today unless you see them next week. Erratic, irregular. They are not punctual to school. That's the meaning of the word. And attendance becomes a problem. Then diminished or compromised performance of teachers who are either infected or whose immediate family members are infected with the virus. Even if the teachers were not infected, but their family members are infected. So they are worried. When they come, they cannot give up their best. Assuming you hear that your family member is COVID positive and is at the quarantine center, how do you feel? You know, there will be a stigma and discrimination. Risk, increased risk of sexual harassment. Risk facing young girls who are regarded as safe and free from HIV infection. There are other jurisdictions, other African countries, they believe that once you have sexual intercourse with a virgin, your COVID-19 or your HIV or hepatitis is cleared. So young girls are being harassed, young girls are being raped for the sake of HIV and AIDS because they want to get cured, because they know that virgin girls, when you have sexual intercourse with them, the virus is cleared, which is a falsehood, and it's also a criminal offense. You know. Let's move on and look at another subtopic: content of education. What you need to learn. When we talk of content, the experience, the curriculum, what the subject matter, what you have to learn in school. So you need to incorporate HIV and AIDS into curriculum, and that's what we are doing right now. It has been incorporated into the curriculum in the colleges of education for us to throw more light on the dangers of HIV and AIDS and other endemic diseases. And that's why we are doing it as a course at the College of Education. So when you go out to teach the young ones, you need to transfer the knowledge to the young ones. You need to develop life skills which equip people to choose positive social behavior and cope with negative social pressure. So this is the essence of this particular course. You're going to empower the young girls, the young boys, to know their right, to be assertive, to know that if I am being raped by an elderly man or a colleague, I need to report. There are certain things that they need to do so that they wouldn't allow social pressure, to influence their decision. Need for early introduction of vocational training in the curriculum to prepare students who leave school early. Assuming you are HIV positive and you are a child, then there should be a way out. There should be a skill training. There should be an apprenticeship program for that particular individual to learn the skill. It can be sewing, it can be hairdressing, it can be any other skill that person will be empowered to be able to live in the face of HIV and AIDS. Other endemic diseases. Let's look at the role of education. New counseling rules that teachers and the system must adapt. Now, because teachers will teach the course, we also become counselors. We advise. And that is it. As you are taking this course, when you become a teacher, you are a counselor. You are a surrogate parent. You are a coach. So all these you need to learn. You need for schools to adopt and develop a new image as the center for dissemination of information about HIV and AIDS, to build to peoples and to staff, to the educational community and to the community itself. So you need to also pass on this information to the community in which you come from, and that's why we have focal persons, we have community leaders, we have focal space where you can also go to your community and be an ambassador of change. Sell the news about HIV and AIDS and COVID and other endemic diseases to your community members, to your colleagues. It's very, very key. So we are all partners in this particular situation, and we need to share the knowledge we have with our people. Need for schools to become multi-purpose development and welfare institutions, delivering more than just formal school education as traditionally understood. So that is it. So we need to function as welfare institutions. We need to support people financially and psychologically. That is what the school should be doing. You provide support. You shouldn't be stigmatized. You shouldn't discriminate. Children who are infected, you shouldn't discriminate colleagues who are infected. We need to show love and support. And the eighth point is what we call organization of our schools. This is an independent point. So another subtopic: organization of schools. Willingness of schools to adopt flexible timetable to respond to the income generating burdens is placed on many people. So assuming you have school children who need to work, to cater for themselves and to be able to have formal education. So the school have to come together and design a flexible timetable to take care of such children. Even if it is evening that you'll be meeting to teach them, it is the duty of the school to plan a very nice timetable, flexible one, so that even if they cannot come in the morning, in the evening they come. And provide for orphans and children from infected families for whom normal school attendance is difficult. Because if I'm an orphan, I need to fend for myself, I depend on others, and they need to work for them. Then the school has to also take this into consideration. Prepare a flexible timetable as stated in the other point to ensure that you take care of the orphan and children whose parents died and left them behind. And then examine assumptions about schooling, such as the age at which children begin schooling, the desirability of making boarding provision for girls, and the potential problem associated with bringing large numbers of young people into relatively high risk circumstances. This is the work of the school. If it is a boarding facility that you can provide, you can do that in order to take care of the girls and then other young people who are infected or whose parents are who died and left them. Let's look at another sub-theme: planning and management of education system. It is imperative of planning a system for the prevention of HIV transmission loss through mortality and sickness of various education officials charged with the responsibility for planning, implementation, and managing policies. Here, with the planning and management of education system, who are those who plan? We have the education officers, we have the directors, we have safety supervisors. All these people and teachers, they come together to plan for the development of education. Now they also say some have died of the virus. So what happens? So management, planning and management of education becomes a problem. Because of what? Death and sickness of various education officials who are supposed to inspect schools. They are sick. Director himself or herself is also not well. So planning and management of the education becomes a problem in the face of HIV/AIDS, even COVID. So we also need for capacity building and human resource planning to provide for potential personal losses to develop new approaches, knowledge, skills, and attitude that will enable the system to cope with the epidemic's impact, and will monitor how it is doing. So once teachers are dying, what do? You need to train and recruit new teachers to replace them. So they will come so now have inexperienced teachers, because those with the experienced brain have passed on. And need for more accountable and cost-effective financial management at all levels of the system to respond to the reduced national, community, and private resources for education. So in this case, the need for sensitive care in dealing with personal and the human, right issues of AIDS-affected employees. There are some jurisdictions, once you are COVID positive or HIV positive, you are fired. They sack you. And it infringes upon the human right. You can take such people to court because it is not your making, and that no employer has any right to sort of dismiss you or sack you because you are HIV positive. The law protects you. Usually people don't know. Let's look at donor support for education. Now that donor countries, or like the IMF and other donor agencies, the World Bank, if they are to support education, now they cannot do it because the focus now is on HIV and AIDS. The focus now is on what? COVID-19. You see it? So donor consent to promote capacity building and develop a self-sustaining system, both of which are inhibited or are prevented by the widespread incidence of HIV and AIDS and COVID-19. So donor support, now that there is COVID, the focus is on the coronavirus. So donor support. Then they have even set up a fund for coronavirus. So that resource that would have been channeled to education is now channeled to what? COVID-19. That is the meaning of that one. So donor concerns list the effectiveness of their input and be undermined by the impact of the epidemic. So now that the focus is on HIV and AIDS, the focus has been drifted from education toward HIV. And donor uncertainty about supporting extended training abroad for persons from heavily infected countries. So, and they are saying that even those days that we have scholarship to go abroad, you cannot go because our country is also severely hit by the pandemic. By COVID-19, you cannot travel. So before they even give you scholarship, they have to look at the COVID cases or HIV cases in your country so that you wouldn't come and infect their population. Though when you're going, they need to take you through rigorous training, but who knows, screening. Let's look at, and all that we have discussed is what HIV can do to education. Now we are going to look at what education can do to HIV. If you are empowered with the knowledge and skills, you know your left from the right, you know what to do, and to prevent yourself from the virus and your family and other members around you. Let's look at it. Education can generate hope because it can offer the following: AIDS-related intervention at three levels. We have where infection has not yet occurred. What we are saying is that in case a country, Ghana, there is no infection, what are the things we need to put in place? Now there is infection. Yes. So there's infection. So what are the things you need to do? When AIDS has led to death, even with the COVID, how many people? People died. What do we do to support the bereaved family? All these are what we talk about, what education can do to HIV and AIDS. You get what I'm saying? So let's look at them one after one. Where infection has not yet occurred, education can influence the epidemic by providing students knowledge that would inform self-protection. That's key. Self-protection is key. You are taking the course so that you are well equipped. So when you go out, you'll be able to guide the young ones to protect themselves from contracting sexually transmitted infection, including HIV. And this one, it includes what? Abstinence or probably condom use. Helping students develop a personally held constructive value system. Because if you know the value system, you know what is right, what is wrong, you know your rights and responsibilities, you'll be able to protect yourself. Inculcating in students skills that will facilitate self-protection. So what are the skills you need to inculcate into the student? You know the ABC: abstinence, be faithful to your partner, condom use, and delay sex. These are the skills you need to equip the learners with. Promoting behavior in students that lowers their risk of infection. If you engage in unprotected sex, that is high risk. Having sexual intercourse with a prostitute, that's high risk. Using condom is low risk. Abstinence, no risk. Enhancing student capacity to help others learn to protect themselves from HIV threat. So what we need to do is to encourage what we call peer education. Let them educate their peers on the dangers of HIV. Let them share their knowledge with their colleagues concerning HIV and AIDS. And that is key. When learners, they learn with their peers, they understand concepts better, they ask questions, and they get reliable answers under the supervision of a facilitator or a teacher. When infection has occurred, all that we have discussed, the other one, it means that there is no infection. And when there is no infection, these are the skills you need to equip the learners with, the knowledge and skills. Now here there is an infection has occurred. So now you are going to strengthening one's ability to cope with personal or family infections. So now my family member is infected. What do I have to do? I have to cope with the situation. I don't need to run away. The person shouldn't be discriminated against. You need to provide support. You need to give the person hope. Promoting care and compassion for those who are infected. So that you show love and care. Support them psychologically, is key. Already they are infected, there's nothing you can do. So what you need to do is to give them hope. Helping young people stand up for human rights that are threatened by their personal or family HIV and AIDS conditions. So if you have a family member who is being sacked from work because the person is HIV and AIDS positive, you can report them to the Human Rights Court. Reduce stigma, silence, shame, and discrimination suffered by people living with HIV and AIDS. So if you are HIV positive, it shouldn't be stigmatized. That shouldn't silence you. It shouldn't be shameful. It shouldn't be discriminated. You need to ensure that all these are cleared, and it is even criminal. If you do that, the law will not spare you. Now, when AIDS has caused death, because people are infected and they are now, so what happened? Enabling one to better cope with their grief and loss. So, if a family member who contracted the HIV died, what you need to do is to provide hope and encouragement to the bereaved family, empowering one to constructively recognize life after the death of a family member. Tell them that, this HIV is not the end. Your family member is dead, but that's not your end. You can still pick up life. You can still reorganize your life and move back to your normal daily activities. HIV shouldn't prevent you from bouncing back. Empower one to demand or accept personal right. I have already indicated. If your family member is being discriminated against, you can seek for justice at the law court. So these are questions for you. Mention 3 areas in education that may be affected by HIV and AIDS. Can we discuss them? Discuss 3 effects of HIV and AIDS each on the demand for and supply of education. Identify and explain 4 effects of HIV and AIDS on the process of what education. Discuss 4 ways education can equip teachers with skills and knowledge that prevent HIV transmission in them. So let's look at the last slide, which is Unit 9, Stigma and Discrimination. What is discrimination? Have you been discriminated against? Have you been stigmatized? Let's look at it. The meaning of stigmatization. It is a process of applying to some individual a powerful and a discrediting social label. Maybe the person is HIV positive or COVID positive. That radically changes the way individuals view themselves and are viewed by others. The stigma, it is just a tag, it's a label that they place on you when you're going and say, the lady who just passed is HIV positive versus COVID positive, or the gentleman who just passed is A positive, COVID positive or HIV positive. The one that happens, you yourself become so disturbed, and others may view you in a different way, and that's what we call stigmatization. Those stigmatized are usually considered as deviant, so it means that you are a bad person. You didn't behave well, that's why you are infected. So your behavior is so porous, you are not disciplined. You are somebody who is bad, that is why you are infected. Or sinful, and as such are being shunned or discredited or rejected or even penalized. So when that happens, people run away from you. They don't want to associate themselves with you. If you are infected and my child is always with you, then I have to make the child aware that in fact this person is positive. Don't go near him or her. Stigma has been described as a trait that significantly discredits an individual in the eyes of others. Because when they say you are COVID positive, how would people see you? When they see you, they run away. When you sneeze, then they want to disappear, you know. And so when you are also HIV positive, people will not want to even come near you. It also has important consequences for the individual, for the way in which individuals come to see themselves. Because now that you are positive, HIV positive, your friends that used to come visit you, they don't come, they don't call. Everybody runs away from you. How will you feel? And that's why oftentimes if you are not careful, you can easily commit suicide. What is discrimination? Discrimination is a distinction made against a person that results in his or her being treated unfairly and unjustly on the basis of belonging to a particular tribe, to a particular group, or you are living with HIV and AIDS, so people will discriminate against you. And they are saying that discrimination arises from the stigma associated with what? HIV and AIDS. When you are coming, they say, oh, these people, they are coming, oh, he's coming, oh, the HIV positive person is coming, you know. All these boils down to what we call discrimination. Let's look at the difference between stigmatization and discrimination. Stigmatization involves branding or tagging a person with discrediting social label that leads to changes in the way the individual looks at him or herself and how others view him or her. On the contrary, discrimination involves making a distinction. Look at the word. This one is about our target, and this one is a distinction against a person that results in the individual being treated unjustly or unfairly because he or she belongs to or perceived to belong to a particular group. So these are the two key, distinction between discrimination and stigmatization. Let's look at this one. Factors that have led to the difficulty of overcoming stigmatization and discrimination in the effort to control the spread of HIV and AIDS in Ghana. Stigma and discrimination is a major challenge globally. Because you are infected, people will shun your company, people will run away from you, they will not support you, they will not come closer to you, and if you are not careful, because of their loneliness, if you are not careful, you can commit suicide. So misconception about the disease and its early association with what? Homosexuality. Oh, they are saying that here because HIV was traced to men who have sex with men, it is often seen as a bad disease, in quote. Misconception. But HIV, men who have sex with men can also have HIV. Women who also have sex with women can also have HIV. And men who also have sexual intercourse with women also have it. So it's a misconception. And that is why oftentimes, immediately they hear you're COVID positive or HIV positive, people will say, then you may either be a gay or a lesbian. And that is why stigma and discrimination cannot go away. The perception that those who associate with them with HIV or with those who are infected are also classified as immoral. So if I'm HIV positive and I'm always with you, then it means that you're also immoral. And the holier than thou attitude, where individuals consider themselves as sinless and clean and pass judgment, value judgment on others, especially in our religious leaders, the churches and the mosques. Because if a member is infected, they say, and because you are a sinner, that is why God is punishing you that way. That is not true. To the lot of pastors who are infected, lot of imams who are infected, how do you then describe them? The disease is associated with what? Shame. They say if you are infected with COVID-19 or HIV, it is a shame. Ways AIDS-related stigma and discrimination cause the spread of HIV and AIDS. So if I ask you to discuss any 3 ways in which AIDS-related stigma and discrimination can fuel the spread of HIV and AIDS in Ghana, this is what you need to look at. Stigma can cause those infected with the HIV and affected by the disease to feel guilty and ashamed, unable to express their virus or their views. It's not virus. Unable to express their views and fearful that they will not be taken seriously. This could make and then keep their HIV status secret. If I know, I will tell you that I'm HIV positive, and because of the shame associated with the virus, because I cannot feel free to express my views with people, then, and I'm HIV positive, I have to keep a secret to myself. I won't tell anybody, and I'll still go on to even infect others. 2. The shame and stigma associated with HIV and AIDS could silence open discussion of the pandemic. If it is not discussed openly, many people may not have the knowledge of what HIV and AIDS and what one has to do in order not to be infected with the virus. But because of the shame associated with it, what happens? It will silence open discussion. So those who are infected will not even want to talk about it. And people will not even want to talk about it. And this could be dangerous. So stigma could lead politicians and policymakers to deny that there is a problem. And that is the nature of the politicians in Africa. Where there is problem concerning HIV and AIDS or COVID-19, politicians are manipulating figures. They are not telling us the truth. And they are able to manipulate the entire system, the health system, in such a way that they won't even tell you the truth, the real picture on the ground. Because when they do that, donor support and what have you, people who want to travel into the country in terms for investment and what have you will not come. And that's why oftentimes they also try to show that kind of information. Stigma could lead people living with HIV and AIDS to have feelings of despair and depression, and to avoid accessing health care and support services. And even our health institutions, sometimes we go, the health care providers will even transpire, or disclose to people what has even transpired between a client and the service provider. Sometimes health officials will even leak the information to people that, oh, this person is HIV positive. But forgetting of the ethics governing our profession. So when that happens, people will never ever access, will never ever even visit the hospital for health care. And then stigma may also undermine prevention by making people afraid to find out whether or not they are infected and seek treatment for fear of the reaction of others. Others will never even what? Will not want to even find out or to test to know whether they are HIV positive or negative. Because if I have become HIV positive, how will people talk about it? How will people react? How will people see me? So they won't even go there. So stigma may also cause those at risk of infection and some of those affected to contribute practicing unsafe sex in the belief that behaving differently will raise suspicion about their HIV positive status. That's why oftentimes those who know they are HIV positive, they will never tell you, but they will go about infecting others. Because if I say use condom, then you may suspect why. We have been doing it all this while. Why are you saying to use condom? So if you behave differently, people will suspect So these are questions for you to discuss. Differentiate between stigmatization and discrimination associated with HIV and AIDS. Discuss any three related AIDS-related stigma and discrimination that can fuel the spread of HIV and AIDS in Ghana. I entreat all of you to watch the video, watch the discussion, like it, comment if there are issues you do not understand, note them down, and let us discuss them. By all these interactions, there are questions you need to answer them. I will be calling for the answers, which is going to form part of your continuous assessment, and nobody should be left out. Encourage your colleagues, share with your colleagues to watch the video, listen to it, play it several times, and when you do that, your life will never be the same. I wish you God's blessings. Wherever you are, try to practice the safety protocols. Wear your face mask, wash your hands under running water, because COVID is real. We need you because you people are the future leaders.